talk about vestibular migraines. The first thing we need to remember is that the vestibular system is very complex, and it is a system, like a large network that fires to many areas of the brain. It's also sending messages to our autonomic nervous system, which is controlling our blood flow to all the cells in the body. That autonomic nervous system is quite a complex and awesome system, and it creates almost a homeostasis in our body involving the hypothalamus, midbrain, brainstem areas, and the insular cortex. So the migraine component is going to come from dysfunction within your vestibular system. So these patients are going to have some sort of complaints, and they're going to have that subjective symptoms regarding dizziness, disequilibrium, lightheadedness. So it starts there. We get the mismatch of sensory information coming into the brain, so we're not able to control the blood pressure and heart rate appropriately, as well as blood flow. When we get vasospasm, changes in the diameter of our blood vessels, we'll end up getting either a headache or migraine. So that's where these patients have dysfunction within their autonomic nervous system, within their vestibular system, and then it combines together to create migraines for them. They're awful because they typically are accompanied by a lot more of this vestibular component where people are really dizzy, they can't get up and move around, super lightheaded, throwing up, a lot of nausea. And some people think like, okay, so what's different from the migraine component? The regular migraines, if it's not a vestibular migraine, it's going to have less of that dizziness component, less of those vestibular symptoms.